Well, Reverend Arline, I am proud of you too, because you're one of the few ministers who followed the time. I thought that we were going to be here all afternoon. So I just want to, some of you don't understand, her only going 37 seconds was divine intervention. Okay, and with that, we have our next speaker. And one of the best things for me about being involved in the planning committee is that I got to talk to new friends and colleagues, and so that's been very good. But also reconnect with people such as Dr. Ruth Zambrana. And Ruth, I won't tell people how long we've known each other. But it's more than 37 seconds. And Ruth, when I saw her earlier today, she said, I have to get 40 years of my research into 15 minutes. But I know that she can do this. Dr. Ruth Zambrana is professor in the Department of Women's Studies and the director of the Consortium on Race, Gender, and Ethnicity at the University of Maryland, College Park. And she's going to be looking at Latino communities and health equity issues there. And would you join me in welcoming Dr. Zambrana?
Okay. Yes, good morning.
Good morning.
Well, I want to start first by thanking Dr. Shiriki Kumaniki, with whom I co-authored the book on obesity interventions and learned a lot from her expertise. Also, Dr. Vanessa Gamble, who we have been long-term colleagues. It was wonderful to see her. And the roundtable members for this invitation and opportunity to provide you with some context for the study of Latinos by race, ethnicity, and socioeconomic status. I also want to thank Meredith Young for all her assistance and follow-up with me. Now, I want to begin with my receipt from Safeway this weekend. Because in thinking about this presentation, I was shocked to really look at this and think about obesity and poverty and those types of things. So I bought 2 apples, and when the cash register said $5.97, I said, oh my God, should I put them back? But I didn't. I kept them because I can. I kept them because I can. And then the blueberries, you know the little packets, $4.99, with 2 little layers of little blueberries, which I usually eat in 2 days, with cereal. And then I went to buy my organic gallon of milk, which is $7.99, right? And I thought, this is the context for social and economic determinants for Latinos, of whom you may know, in general, 1/3 are uninsured. They live in communities that lack resources, and about 1/3 lack health insurance. Now, let me just also comment that the apples and blueberries are not organic. That would have been, I assume, probably close to double. So we cannot speak about obesity for low-income individuals, which is whom I am speaking about, without acknowledgement of an unregulated food industry that caters to the poor with loads of nutrient-poor, high-caloric, artificial ingredients and chemically enhanced foods. So when you think of my bill for a couple of fruits, about $25 and a little milk, you can go to McDonald's with a family of 4 and probably everyone can eat very well. So let me start out with my 4 points. Okay, I want to watch. Where do I get the time? Oh, when did I start? 12:15? Okay, 12:14. Let me start out with 4 points that I hope to make. One is that, and I also want to thank Angela and Siobhan because they really set up the context for what I want to speak about. My focus has been on the history Of the historically underrepresented Latinos in this country, predominantly Puerto Ricans and Mexican Americans and other low-income Central Americans who came to the United States because of imperialist intervention in their countries, particularly El Salvador, Honduras, and Guatemala. I want to speak about social determinants and risk factors and how they affect the everyday life of Latinos. I want to speak about the equity discourse as action rather than research. An equity focus on structural racism, because that's where, I think as Siobhan said, we hate to use the R word, but we are talking about structural racism. In policy and resources, Angela talked about the policy. Who implements those policies? And what are the policies for discrimination? And how, you have to wait years to do anything with the EOC, et cetera, et cetera. And I love the idea of priority populations that Shariki spoke about. And we are having a really hard time in America defining priority populations because of the current conditions, but because of who we are and our fear of identifying priority populations. And the fourth point I want to make is that culture is not a predictor of inequality. It is the structural racism that predicts inequality. And I think also from an intersectional perspective, which is where I come from, we need to have explicit assumptions that the U.S. is not a blank slate of immigrants. We are not a country of immigrants. There were people here before the English and the Scottish arrived. And we have to discontinue that myth in order for us to be able to deal with our history. And I think, as someone mentioned, equity will benefit all Americans, or at minimum the 80% who make less than $100,000. So this is good for everyone. Let's start with who are Latinos. Now, there has been a tremendous confusion in the U.S., which continues to exist, because I started this work 40 years ago and we're still there. Even I pulled out this book because I have been following all the reports of the Institute of Medicine and the National Research Council. Who are Latinos? Latinos are from 22 countries throughout the world. They are white, they are black, they are mestizo, they are indigenous. So they run the whole spectrum. So Hispanic doesn't capture anything except the history of the oppressor, which was Spain, on different countries throughout the world. I just want to go back not too far, but to the 1980s. So in the 1980s, two forces emerged. One was the Mexican and Puerto Rican origin groups really resisting the label of Hispanic because it denied their ancestry, it denied their background. And also it was a call to make people aware of the denial of their social and economic opportunities throughout the history of this country. So in my book that was published in 2011, I talk about the history of all these countries. Mexican Americans were denied education in California and Texas up until the 1960s. They were not allowed to get a high school education. And when we look in a minute at their educational level, you'll see why it is so low. And it was also impacted all domains across their life course, including home ownership, higher education, employment opportunities due to the institutional racism. The 2000s saw the massive migration of Central Americans. Many were members of the European diaspora from World War I and World War II. Others were more indigenous groups, and others were black groups like Brazil, Venezuela, and Colombia. So that gives us a little bit of where the issue really began to rise was in the 1980s. So let us see where is that little thing here? Oh, here. Let's just look for a moment. How do I do this? This one? Oh, okay. So let's look at the Hispanic population by origin. Mexican Americans have consistently represented over 60 to 70% of the U.S. population. 2015 was 63.3%. Hispanics in general represent 18% of the U.S. population, with the majority being Mexican and Puerto Rican. With the immigration, we have seen a change in the order here, because Cubans were always third, but now they are fourth. So Salvadorians, 3.8%, Dominicans, 3.3%, and Guatemalans, 2.5%. And then we have all the Latin American countries that have been coming to the United States since the 2000s due to a lot of civil unrest and disruption. I want to look at socio-demographic data because here is where sort of the rubber hits the road. Bachelor's degree, I want you to look at foreign-born. So Mexicans are the least likely to be the foreign-born. And I just want to raise that for us because I think that's really important because we continue to look at Mexicans as the immigrants. They are not the immigrants. Furthermore, Mexicans have been here for 15, 17, 18 generations, so they're not coming across the border. They're really coming home, and we have to remember that. They do represent the surplus labor force of the United States. They are the youngest group, the Mexicans, because of this immigration back and forth. They are the least likely to be college educated. Now, I think every time I look at this figure, it's amazing. Only 9% of Mexicans get a bachelor's degree. So they are least likely to be educated. When 26% have a high school diploma after 25. Mexicans and Puerto Ricans are the most likely, and the Dominicans and Guatemalans to live in poverty, very close there. No health insurance. Again, about 1/3 of Mexicans have no health insurance. This has not changed for the last 40 years, by the way. These patterns have remained the same. And that's what I think we need to look at the effect of having something the same over 40 years. Puerto Ricans are live in poverty. Health insurance. And then proficiency in English. Again, Mexican Americans and Puerto Ricans are the most likely to be proficient in English. And there's a myth that they are the least likely to be proficient in English. So the data sort of tells us the story. And share of citizenship, Mexican Americans, Puerto Ricans, and Cubans are the most likely to be citizens. So I think that's important for us to know. And the Cubans are refugees, so they have continued to have refugee status even in the third wave of Cubans coming into this country. They are the most likely they are sort of the model minority for us with high rates of college. They are the most likely to be college educated, followed by Dominicans and Puerto Ricans. So I just want to go quickly through some of these so that we begin to look at the poverty status of the groups. The Hispanic, 81%, have a full-time worker in the family, which is very close to whites and Asians, but they are also most likely to have income below the poverty level. So again, we see the three groups that we have spoken about today: African Americans, Hispanics, and Native Americans have the lowest family income. One of the things I wanted to do was to look at what we have focused on in terms of Latino health. We've talked a lot about diabetes. It is an issue. Obesity, we have 464 articles. Diabetes, 624. Physical activity, 278. So we have a lot of research on Latinos. The metabolic syndrome, which is a cluster of obesity, obesity, high cholesterol, and hypertension. And you see health insurance is 108. So what have we learned from these things I think is important. The context, as has been mentioned, is social and economic determinants. Now, this is not new data. We have 40 years of the same research speaking to us about the physical environment, about the quality of housing, about the zip code. We have Rodwood Johnson Foundation telling us where you live determines when you die. Institutional discrimination is less likely to be studied, but that's definitely there. And that gets exercised or executed through our policies. And I think Dr. Komanicki's in her list of things. When we have school systems in low-income areas that are funded by housing costs, by housing values, that's not going to work. That right there is inequitable. We can never have equity if we continue that process. We have the availability of healthy foods. There's a whole body of knowledge now on food deserts, on lack of available foods, on very expensive foods. How do we change that? We don't have available recreational spaces. I just observed the other day in Rock Creek Park in Maryland, a couple of people walking hand in hand, and I thought to myself, all this is part of this presentation thinking, how can low-income people walk in their neighborhood and feel safe, hand in hand, at 7 o'clock at night? So we need available recreational spaces, parks, gyms. We need community safety. Many of the schools now no longer have physical education in the schools, particularly in low-income areas. Private schools still do, but many do not. How do we reinstitute that? What does that mean for many of our children? And clearly, access to quality and healthcare resources. 1/3 of this population does not have health insurance. If we disaggregate it for Mexican Americans, it is probably a little bit higher. So what have we learned? We've learned that poverty is a barrier to lots of things. We learned that employment without health care benefits is a problem in access. So Mexican Americans and Mexicans, where do they work? They work in rural areas, which is a disadvantage. They tend to be, fruit picks, seasonal workers, migrant workers. They go up and down the East Coast and the West Coast and the middle of the country in the chicken industry, in the mushroom industry, in the tomato industry. There is some movement to the South now. None of those jobs have health care benefits. So that continues to perpetuate a problem for them and their children. They have low education, low health literacy. So that decreases their opportunity to receive good care. And acculturation construct, in my view, is a problem. It's an individual-centered approach that essentializes all Mexican Americans as non-English language proficient and homogenizing all immigrants and all Latinos into one category that really disallows our focus on what are the social determinants. Because South Americans tend to be from the upper classes, Cubans tend to be from the upper classes, they tend to be racialized white, so therefore their whole trajectory is different. And we need to begin to acknowledge who are the priority populations. And the new work has added, as I think Siobhan mentioned, some institutional racism and discrimination as critical determinants of life course experiences and life course social and economic disadvantage. As Shariki says, not mean they don't have other advantages, but they have economic and social disadvantage. Okay, I have 1 minute. I'm going to go through this. I mean, there's a lot of data that tells us about issues of healthcare, delay of access, and these data are not significantly different. I thought the issue of wealth is really important, family wealth, because families, it is very hard to get out of the intergenerational cycle of poverty. So when we look at wealth, we see that Hispanics and Blacks, their wealth, racial gaps in household persist for about $43,000. The impact of the 2006 recession, which I did not include here, decreased the wealth of Hispanics by 85% and African Americans by about 50%. So we saw a big decrease in the little bit of wealth they had after that 2006. Here I found these data. They're very hard to find because we do not do a lot of work by Hispanic subgroup, which is important. But when you look at physical obesity for Mexican U.S. born, it's about 37.3% and overweight 71.7%. These rates are pretty high. Mexican immigrants, physical inactivity 48.3%, and overweight the same. For the Puerto Rican mainland, obesity 35 and 70, and Puerto Rico born 34.7 and 71%. For the Cuban immigrant, we see the less, and again, what we see there is the relationship between socioeconomic status, education, and more physical activity, less obesity. And the Central American immigrant, we see less than 50% physical activity and about 22% obesity. So when we look at this, we look at the differences, and these types of issues can perhaps help us to identify what are the priority populations. Now, this study was done, this is the JAMA network. You can't see this. I have actually a hard copy here. It's a study of Latinos, which is a nationwide study on 16,000 Latinos, and it gives us the rate of obesity. One of the things, and I have spoken with Shariki though, about 78% of these individuals are immigrants. But we look at obesity. So the highest obesity, again, tends to be for Dominican and Puerto Rican, for men, and for women, Dominican and Puerto Rican, with South Americans having the least rates of obesity and Cubans having lower rates of obesity. So again, when we look at the Mexican and Dominicans and the Puerto Ricans, who also have all those social determinants that have been spoken about in terms of poverty, psychosocial stressors, lack of benefits, etc. These are the populations that I think deserve more priority. Now, this is just a quick thing. I happened to look at Latin America, to look at life expectancy. And again, what we see is that some of these countries, like Chile, and even Mexico for men, that their life expectancy is very different than the United States. On the bottom is the United States. And then we have Costa Rica has higher life expectancy for both men and women. So, and Chile has higher life expectancy. And of course, Canada. Now, I just want to conclude. How many more minutes do I have? 5 more minutes? None. Okay, let me just conclude. I took 15 years to write a book on Latinos to essentially see what do we know, what has been done. And this was the reflection, this was my conclusion. And it was the ways in which Latinos are studied requires extending the paradigm to decenter culture and center social determinants. The unremitting focus on culture rather than inequality and access to healthcare resources, material conditions, and neighborhood effects has derailed knowledge production on Latinos and contributed to increasing disparities and inequity. I think the solution now is not to do research, but to really translate what we know. We know a lot on what we need to do, and I think we should go ahead and do it as opposed to continuing to study the same material conditions and expecting to find a different answer, because we won't. Thank you.